Assalamu alaikum and welcome to the series of lectures on respiratory unit. In this, we will be discussing about asthma, COPD and pneumonia. The material for this unit has been taken from Medical Diagnosis and Management by Anam Danish, Lippincott Illustrated Reviews Pharmacology, and Clinical Pharmacology and Therapeutics by Roger Walker. I am Shoaib Muhammad, lecturer in the Department of Pharmaceutics, Faculty of Pharmacy, University of Sindh. So in this lecture, we will be discussing about pneumonia. This is the outline of the lecture. In this lecture, firstly, we will be having introduction of pneumonia. Then we will discuss the epidemiology, causative agents, signs and symptoms, classification, and finally, we will be discussing treatment of pneumonia. So firstly, what is pneumonia? The pneumonia is an infectious disease that causes inflammation into the air sacs of the lungs. Now these air sacs are called as the alveoli. Because of the infection, the alveoli become filled with the fluid or the pus, and because of that filling of the fluid or pus, the patient feels difficult into the breathing. In pneumonia, the patient may have infection in one or both of the lungs. If one of the lung is infected, it is called as the single pneumonia, but if both of the lungs are infected due to pneumonia, we call it as the double pneumonia. As the pneumonia is an infectious disease, it is caused by the bacteria, viruses, or fungi. The most common type of the pneumonia is bacterial pneumonia, which is most commonly present into the adults. The pneumonia is the most common infectious cause of death in the United States. Now, if we discuss about the epidemiology of pneumonia, pneumonia is one of the major cause of death in children of less than 5 years of age. The pneumonia causes more number of deaths or causes the most number of deaths as compared to other diseases. In Pakistan, it has been reported that about 15 million episodes of acute respiratory infection are faced by children each year. That means in a single year, the children who are less than 5 years of age in total, they may have 15 million episodes of the acute respiratory infections. So that means these are the most frequently occurring infections into the children. And the child pneumonia contributes approximately 30% of the total global pneumonia mortality. Means out of the total people who are dying due to the pneumonia, the most of them are children of less than 5 years of age. Means the children are more prone to the pneumonia infections. The WHO shows that about 450 million cases of community acquired pneumonia appear each year, and from them about 3.9 million people die. Now we come to the causative agents that cause the pneumonia. Now, as the pneumonia is a infectious disease, so the causative agents of pneumonia are mostly the bacteria, viruses, fungi, or the mycoplasma. So firstly, we will discuss about the bacterial pneumonia, the pneumonia that is caused by the bacteria. So the most commonly occurring and most serious types of the pneumonia are caused by the bacteria. The most common organism that is involved into the bacterial pneumonia is Streptococcus pneumoniae. The other organisms that may cause bacterial pneumonia include the Chlamydophila pneumonia, Legionella pneumophila, are one of the organisms that may also cause the bacterial pneumonia. And of course, the treatment line for these different types of the microorganisms will be different. The other category that is causing the pneumonia are the viruses, and we call it as the or classify it as the viral pneumonia. It is most often caused by the respiratory viruses, and they most commonly occur into the young children and the older people. The viral pneumonia is most commonly not very serious, and it has an infection for short period of time as compared to the bacterial pneumonia. The species that are causing the Viral pneumonia include the respiratory syncytial virus and parainfluenza and adenoviruses. The other organisms that cause the pneumonia include the mycoplasma, and the pneumonia caused by mycoplasma is called as mycoplasma pneumonia. The mycoplasma are basically the bacteria, but their composition is slightly different from the bacteria in that they do not contain any cell wall, and they are smaller in size as compared to the other bacteria. And because they do not contain any cell wall, so we have a class of the antibiotic that specifically act on the cell wall of the bacteria, like the penicillins. So these type of the antibiotics will not be effective on to the organisms that are causing the pneumonia, the mycoplasma pneumonia. And these type of the organisms mostly affect the older children and the young adults. The last class of the organisms that are causing the pneumonia are the fungi. The pneumonia caused by the fungi is also not very common, but if people are getting large amounts of the fungi from the soil or bird droppings and that are going into their respiratory tract, the people may suffer from the fungal pneumonia. Most of the time the fungal pneumonia is occurring into the people who are having chronic diseases or whose immune system has been weakened, because the fungi are the opportunistic organisms. So if they find a way into the body because of the destruction or weakened immune system, they will have an opportunity to cause an infection. The one of the common examples of the infection that is caused into the weakened immune system is the pneumonia caused by the pneumocytosis jirovecii, or we call it as the pneumocytosis jirovecii pneumonia. That is most common occurring into the HIV/AIDS patients, because into the HIV/AIDS patients the immune system is weakened, and even the pneumocytosis jirovecii pneumonia is one of the common indication that the patient is suffering from the HIV/AIDS. Now the signs and symptoms of pneumonia. So the pneumonia can occur as a mild or life-threatening infection. So the symptoms will be from mild to life-threatening. The most common symptoms that occur into the pneumonia patient include the productive cough, fever, sweating, chills, shortness of breath, and chest pain. Now, the signs and symptoms of pneumonia patient can also vary based upon the causative agent. Now, as we have earlier discussed, the viruses caused the very not very severe infection. They cause the mild infections, and mostly they are infecting the children or the older patients. So the viral pneumonia may start with flu-like symptoms such as wheezing, and the patient may have high-grade fever after 12 to 36 hours. However, as earlier discussed, the bacterial pneumonia is one of the most serious or the dangerous pneumonia, and the patient may feel the fever of about 104 degree Fahrenheit. The patient may also have with profuse sweating. There may be bluish lips. Maybe there is severe infection and the lungs are unable to supply sufficient amount of the oxygen to the body. There will be bluishness of the nails as well, and the patient will be also facing confusion. Maybe because of the less amount of the oxygen is reaching into the central nervous system, and these symptoms into the central nervous system are also appearing. Similarly, the symptoms of pneumonia may vary into different age groups. Like the children under 5 years of age may have fast breathing. Infants may feel vomiting. They may have lack of energy, and they also can have problem into the drinking and eating. However, the older people may have a lower than normal body temperature. Now, the classification of pneumonia. We can classify the pneumonia based on various ways. Number one of the ways is based on location of acquiring infection, from where the patient has acquired the infection. So there may be two locations majorly. Number one is the community outside a medical facility. So if a person is having or acquiring an infection outside a medical facility, maybe at their home, at their town, at their city, from the other people, we call it as the community acquired pneumonia. While if the patient is having an infection or pneumonia when he is at an hospital, and he has got the infection from the medical facility, we call it as the hospital acquired pneumonia. Now this basically happens if the patient is staying into the hospital for a longer period of time. And the hospital acquired pneumonia is one of the most serious types of the pneumonia, and it is more dangerous than community acquired pneumonia because the infections that are acquired from the hospital, the microorganisms are most often very resistant to the antibiotics. The causative agents of the hospital acquired pneumonia include the Pseudomonas aeruginosa and Staphylococcus aureus. The pneumonia can also be classified into aspiration pneumonia or ventilator associated pneumonia based on how the infection has been acquired. Now, if the microorganisms have gone into the lungs through the food or drink or saliva, we call it as the aspiration pneumonia. This occurs when patient has any problems into the swallowing and the infected food or drink or saliva is going into the lungs and causing the infection into the lungs. So we call it as the aspiration pneumonia. The other type is the ventilator associated pneumonia. So into the severe infections or the severe health related problems, the patient may be going onto the ventilator, and if the patient is going onto the ventilator, the microorganisms may be present into the tubings that are going into the lungs, and that will eventually cause infections into the lungs. And eventually, of course, the ventilator is most often provided into a healthcare facility, and the microorganisms, as we have earlier discussed, that they are very resistant, and in case of the ventilator pneumonia, it will be a very serious infection into the patient. So finally, we'll be discussing the treatment of pneumonia. So if a patient is suspected of the pneumonia, of course, we will go for certain diagnostic stage for the confirmation of the pneumonia. That may include the X-rays, and it's an infectious disease, so we have to make the confirmation of the which microorganisms is causing the infection. We have to go for the culture sensitivity test, that which microorganism is causing the infection, which antibiotic will be effective onto this patient, and after that determination, or until the results are coming, we will go for the treatment on the basis of empiric therapy to eradicate the microorganism that is causing the infection, and complete clinical cure are the primary objectives. We have to also minimize the associated morbidities that the effect onto the renal or lung system or the hepatic function. The therapy should not have severe consequences on that, or the infection should not have the severe consequences on the renal system or the lungs or the hepatic function. And we may also have to give oxygen support in one of the severe cases. So as we had discussed the classification of pneumonia, in that we said based on the location of the infection, can be classified into the community acquired pneumonia and the hospital acquired pneumonia. And we also said that the hospital acquired pneumonia is rather more difficult to be treated because the organisms are most often resistant. So there will be different treatment for the community acquired pneumonia and different treatment for the hospital acquired pneumonia. Firstly, we will be discussing the treatment for the community acquired pneumonia. In this table, there are different scenarios mentioned, and based on these different scenarios, different drugs will be prescribed to the patient. Now, as the first scenario says, if the patient is having mild to moderate pneumonia and if the organism is not known, okay, So in this situation, firstly we will have to prescribe patient the amoxicillin plus macrolide, that may include the erythromycin or clarithromycin. And the second scenario is if the patient is having severe pneumonia and still the organism is unknown. Maybe the patient has come to the hospital and still the culture sensitivity tests have not been performed. So we have to give the empiric therapy to the treatment, and in these situations we can prescribe the patient with co-amoxiclav, that is the combination of amoxicillin and the clavulanic acid along with a macrolide. Or in other situations we can prescribe cefuroxime along with a macrolide in case of the penicillin allergy. If the patient has infections due to the pneumococcal pneumonia, now the culture sensitivity has been performed and we know that which microorganism has caused the infection. So in these situations we can go for the penicillin, or we can go for amoxicillin or a macrolide. If the infection has been caused by the Haemophilus influenzae, we can go for the amoxicillin if the microorganism is non-beta lactamase producing, and if the microorganism is producing the beta lactamase enzyme, we can go for cefuroxime or co-amoxiclav combination. And then if the infection is caused by the staphylococcal pneumonia, so again we have two options. Now if the staphylococcal pneumonia is non-MRSA, that is the methicillin resistant Staphylococcus aureus, it is not resistant to methicillins, so we can administer fluoxetine along with a second agent that may include the rifampicin or the fusidic acid. And if it is resistant to the methicillins, we call it as the methicillin resistant Staphylococcus aureus. So firstly we have to go for the culture sensitivity that will clearly mention that whether the patient is having the methicillin resistant Staphylococcus aureus, and then we will go for the and if the microorganism is MRSA, then we will go for linezolid or the go for the glycopeptides. Then if the patient is suffering from pneumonia from Mycoplasma pneumoniae, we can go for the macrolides or the tetracycline like the doxycycline. If the infection is caused by the Chlamydophila species, we can again go for the tetracyclines. And finally, if the patient is suffering from the Legionella species, we can go for the fluoroquinolone, such as the ciprofloxacin, or we can go for a macrolide such as the clarithromycin, if the patient is intolerant to the fluoroquinolone like the ciprofloxacin. Finally, we have the treatment for the hospital acquired pneumonia, that is one of the most serious infection and microorganisms are resistant to most of the antibiotics. So in these situations, mostly we have to go for the uh, combination of the therapies or the broader spectrum antibiotics. So firstly we can administer the co-amoxiclav. Also we will have to go for the culture sensitivity test. uh, Otherwise we can go for the uridopenicillins along with the aminoglycosides like the piperacillin plus gentamicin. We can also go for cephalosporin plus an aminoglycoside the cefuroxime plus gentamicin. We can go for the clindamycin plus aminoglycosides. We can go for ciprofloxacin plus a glycopeptide like vancomycin or teicoplanin. We can go for the meropenem monotherapy, linezolid, which is a broad spectrum antibiotic. We can also go for the combination of the linezolid with other antibiotics. We can go for the aztreonam combinations. We can go for timocillin, or we can go for the ceftazidime monotherapy. So this is all for the ammonia and its treatment. Thank you very much.